So Children's Mercy is located in the heart of Kansas City. We are a freestanding, non-for-profit pediatric organization founded in 1897 by the Berry sisters. One was a dentist and one was a doctor, and we recently just celebrated our 125 years, so that was pretty exciting. We employ over 8,400 employees, over 3,000 of them are nurses, and then we have about 780 faculty. Children's Mercy does employ all of their physicians, which is something new to us in the last probably 5 years. We also have about 1,000 allied health professionals and over 1,000 volunteers, many of which were Children's Mercy employees previously, and they just love it so much they keep coming back. So we have 2 hospitals. We have the hospital in Kansas and we have the hospital at Adele Hall, or downtown, which is the mothership, as I like to call it. And you can see on the screen here, that's the picture of Children's Mercy at the Adele Hall campus. Between the 2 systems, we have about 390 beds. Our outpatient ambulatory services is very busy with almost 400,000 outpatient visits a year. We have about 300,000 urgent care and ED visits. And in the past year, we had over 14,000 admissions, almost 20,000 surgeries, and we have our own pediatric transport team that transported about 6,000 patients. They do both air and ground, so they're extremely busy as well. All right. This is just a map of where we're located. You can see here on the Kansas side, we've got the Kansas Hospital, and then we've got the Adele Hall campus on the Missouri side. And then those other little dots are the freestanding, or some of them are little strip malls of our campuses that house either or sometimes both, an urgent care or our specialty ambulatory centers. We also have expanded to the region. So we go as far west as Garden City, almost to the Colorado line, as far south as Joplin, Missouri, and we go north to St. Joe. We recently completed the Children's Mercy Research Tower. That was completely funded by donation, and it is a beautiful building where you look out all the glass windows and you can see just a beautiful view of downtown Kansas City. There, they're focusing on genome medicine, advanced therapeutics, and just how can we be more innovators in healthcare. We have a level 1 trauma center, a level 4 NICU. We have over 50 pediatric specialty areas. We have been honored by Magnet for 5 times in a row, and then we're also a partner with the University of Kansas Cancer Center for its NCI designation. And of course, we are ranked within U.S. News and World Report as one of the top children's hospitals. And for those of you who get to take part in that survey every year, it's a lot of fun, isn't it? First time this year, and I was like, wow, there's a lot to this. Whoops, I need to go back. Oh, I'm missing a slide. Okay. So we have 3 locations within ENT. ENT is one of the surgical subspecialties within the organization, and we are located at Children's Mercy East, the downtown campus, and Children's Mercy Kansas. We are a very busy clinic. We have 28 providers, 14 of them are advanced practice providers, and we have about 14 physician surgeons as well. We see the last calendar year, I believe it was calendar year 2022, we saw about 22,000 patients, and we performed about 5,000 surgeries between our 2 locations. In the clinic, we do different types of procedures such as flexible scopes, tongue tie releases, FFVNs, the fees, ear cleanouts, all of those fun things. And then also during the visit, the care team is a nurse, a care assistant, and a provider. So the patient and family is seen by all 3 of them. We also work closely with ancillary staff. We have audiologists, child life specialists, and lactation that come to visit the kiddos in clinic. And at our Adele Hall campus, we have 3 audiology booths, and we have 2 at Kansas and 1 at East. So our previous state of our clinic, prior to the work that we're getting ready to talk about, consisted of 2 separate groups. We had the Children's Mercy Kansas group, which had a facility director, a nurse manager, an assistant manager, surgery schedulers, nurses, and care assistants. And then at the Adele Hall campus, which also covered the East Campus, we had a service line director, which was myself, Parisa, our clinic manager, and then we had nurses, care assistants, and surgery schedulers there. The providers went to all the locations. When they were at Adele Hall and East, their team went with them. When they went to Kansas, they had a separate care assistant nurse team. Excuse me. This meant that patients were interacting with two separate teams from multiple areas, which at times reduced our standard of care that was being met. There was lack of continuity between the teams, and this led to, in times, potential harmful patient outcomes. If you were seen at the Adele Hall campus, you were sent home with discharge instructions that sent you to the Children's Mercy Adele Hall phone number, and part of our phone tree, you were able to talk to a triage nurse right away. Get triaged, get an appointment if you needed to urgently, or have yourself, those parents that call because their kiddo has an ear infection after tubes, and we're like, it's great, you have tubes, you have drops, put them in your ears, you'll be fine. They weren't getting that same attention if they called the Kansas location because the system was set up different, and they didn't have a triage team at the Kansas location. Instead, those messages went to a patient access rep. That patient access rep then put the message into the portal or the message center that we use. We have the Cerner system, any of you familiar with Cerner? And then the nurses answered as they had time throughout the day. So there was a potential delay in care for those patients who were being served at Kansas. Our system was broken, and we knew that. We knew that we had gaps we needed to meet. So as a leadership team, myself, Parisa, and our leaders from Kansas with our senior leaders came together with some frontline team members, and we started kind of a staffing workshop. We realized as a leader team following this workshop that between the two locations, we had a bigger problem, right? We attempted to give it that good college try. We attempted to do it the way it was set up to be done. However, in the end, we knew that we had to improve our metrics, our staff expectations, our staff engagement, our patient experience, the patient outcomes, and that the dual leader lines was no longer working for us. To our favor, this was also occurring in our neurology, GI, dermatology, endocrine clinics as well. So we were able to partner and learn from each other as we started this journey. We still had too many variables going on between the two areas. It was the common theme of somebody thought anybody was doing the work everybody could do, nobody did it, and everybody got mad, right? So we were like, okay, let's do this. Our senior leaders were on board. Parisa and I, we are all about change management and trying new things. If it's safe and it's legal, then we're going to try it. That's our motto. All right, Dolly Parton fans? I love her to my core, and since I've been little, I loved her. So much so, my 4.5-pound Yorkie, her name is Dolly Parton, and she is just as much of a diva as Miss Dolly is. So why did I use this quote? If you don't like the road you're on, start paving a new one. Well, Dolly has leadership traits, right? She is authentic. She is real, even though she is fake. She is able to be optimistic and the biggest downfalls, right? I mean, if you know her story, she came from nothing and look where she's at today. She's an icon. From everybody who is 2 generations ahead of me to my own children's generations. They were raised on Dolly as well. I have an 18-year-old and a 15-year-old. She's an advocate for what she believes in. And we believed in what we needed to do was to forge a new path, to be the change we wanted to see.